Hi everyone, thank you for joining us today here at ICRF. My name's Victor Ona. I am a member of ICRF and a director. At ICRF, our goal is to carry out research into demystifying the issues that we have around cancer in Kenya. We started in 2018, but we got registered in 2020. We now have a global team from around 8 countries. And we have 3 key divisions at ICRF. We have a research division, which is concerned with carrying out oncology research. And then we have a clinical division, which is concerned with carrying out concerned with building networks with cancer specialists and facilities. And then we have the outreach division, which is responsible for carrying out public education on matters concerning cancer. So a very big welcome to everyone who is here today, both ICRF members and those who are not members of ICRF. Feel free and you are welcome. This session is being recorded. We will upload it on our YouTube page. If you search for Cancer Research Kenya, you should be able to access the video. And this is part of a series until the year ends, where we will be carrying out online education, and each session will be tackling a different type of cancer. So you'll find plenty of videos around that, and you are more than welcome to participate. And then we also have physical awareness sessions around the country. This month will be in July. This month of July will be in Machakos. Next month we will be in Eldoret, and then we proceed to Nyeri, and then we go to Kisumu, Kakamega until we finish off the year. So our goal is to reach as many Kenyans as possible, educating them on how educating them on the importance of going for early screening, where to get help, and things along that line. Lastly, as we proceed, I would like to ask everyone, please ensure that your microphones are muted if you are not the one sharing, so that we have minimal interference. On your screen, there is a chat option. You can always post your question there, and then we will be able to address your question, or rather ask the speaker to answer your question. And then we also have the option to raise your hand. You have the option to raise your hand. If you raise your hand, we will be able to see, and we'll be able to give you a chance to proceed either with your comment, with your question, or with the clarification that you want to make. And if there's anything you don't understand or need help with, just type it in the question section and I'll be able to assist you. Thank you. So as we start, today we are looking into colorectal cancer. Colorectal cancer, unfortunately, the number of colorectal cancers is growing in Kenya per year. Last year, we had about 1,500 plus people recorded new infections, 1,500 plus newly recorded infections. So we are trying to just start and understand what goes on in colorectal cancer. We have a team that is going to present. Each presenter will share a few slides, and these slides can be made available if you wish. You can just leave us your email and we will send them to Felix. Over to you.
Okay, thank you very much, David. So when we're discussing about colorectal cancer, this is a cancer that just from the name comes from a hybrid. It is a combination of It's a combination of two names. We have the colon and we have the rectum, so that we form the word colorectal cancer. Uh, the colon is also known as the large intestine, and part of it we have the rectum. So this is the cancer that majorly affects the large intestines. And as we know, the large intestine is involved in the absorption. From the image that has been displayed on your screen, we can see uh, there's a there's a reddish orange region. Then we also have the blue region. So the orange region is the large intestine, and as you can see, there are some parts which have some red marks. So this cancer majorly affects this part, and those red marks are just some illustrations of how the cancer, or the fact that the cancer can affect. Then on the image on the right, this is how the cancer will develop. So there's a stage 0, stage 1, stage 2, stage 3, stage 4. So from stage 0, it is a small mass that has accumulated in the large intestine. Then with the time, it will grow. That is if early diagnosis has not been made and proper measures undertaken. Next slide. For the statistics, as I've said, it develops from small growth in the colon, which are also known as the polyps, which will later on develop to be a large mass. Then this colorectal cancer is ranked fourth in women and third in men. That is according to a research done by Globocan. It also has a mortality rate that is globally of around 880,792 deaths. Those are the number of cases which were reported last year. Then for the new cases, these are the cases which are recorded with each new test that has been carried. We had 2,116 new cases. But funny enough, from all these new cases, we had 1,466 deaths. So that means out of the 2,300 that got the disease, 1,400 died, showing that it has a very high mortality rate. Then amongst the people that have been affected, those from our locality, we find that there's a former member of parliament, that was Ken Okoth, who was representing Kibera. He's amongst the latest people in our community that was affected by this type of cancer. This just depicts that this cancer is not just anywhere, but it can also be found in our community. And for such a person, is well known, but it shows that there are also some people in the ground, those local people who might have been affected but not been recognized. Next slide, please. So we have some challenges which are affecting the colorectal research in Kenya. Is this assumption that this cancer is uncommon, just as I had mentioned previously. Now that we only know about Kenocott, so some people assume that this cancer it's not there, it does not exist. Then there's this notion that the African diet, the meals we eat, is high in fiber, and so it will help mitigate the disease. This is a myth that should be demystified. Then, according to our testing capacity, we have very low testing rates and screening of cancers. This is majorly because of the economic situation of the country, and also the instrumentation and also the training that is available. Then we have a lot of misdiagnosis with other diseases. For example, when a person has something like Crohn's disease, which is some inflammation of the colon, it might be misdiagnosed with the colorectal cancer. So this brings a challenge in the colorectal research. Then we have limited literature and documentation. Most of the data that we're using is from the US, is from Europe, is from India, that is the Asian world. Little research is being done in Kenya, which brings a lot of challenges in even trying to find out what is the real situation for our country, because that represents the documents we have represents the information from people in those countries that research has been done. But in our local setting, that is missing. Next slide. So if we compare, this is just a comparison between the United States and Kenya. We are looking at the trends, the number of new cases reported versus those existing, and it is gender wise. So the graph on the left, the US is represented by blue and Kenya uh, with the red color. So when you check at the plots for the US, there's a decreasing trend. But when you check on the Kenyan data, it is increasing, showing that in the US something is being done, or there's something that has been implemented or is being done to reduce the cases. But for a Kenyan setting, it is actually alarming because the cases are increasing. Then when you check for the distribution of the two cancers in the US, rectum cancer is quite low compared to the colon cancer. They have more of colon cancer than the rectal cancer. And for Kenya, we find that it is 50-50. So the new cases reported, we have 50% chance that it can be either side. Then on the age distribution, we find that in the US, the majority of those who are affected is between the ages of 65 to 74. But for Kenyan system, we have 55 to 64. But it's also good to note that when you look at this graph, colorectal cancer affects each and every age set, whether those below 20, as you can see, then there are those ones between the ages of 20 to 34. That group is assumed to be the youth. There's this notion in our country that cancer is for the elderly, cancer is not for us. But when you check at this statistical representation, it shows that the youth are equally affected as those between the ages of 35 to 44. So this brings about the idea that we also need to do diagnosis for not only the adults but also the youth, because when you check those above 84 years of age, the cases are quite small. So with this awareness, it will really help to know someone can be easily diagnosed and proper measures are taken. Next slide. This is just a representation of the cancers in Kenya, and this is the estimated number of new cases in 2020 worldwide, female of all ages. And we find that for the ladies, breast cancer takes the highest percent. That is followed by, there's also colorectal cancer worldwide at 15%, lung cancer, which can be maybe attributed to the smoking or just the pollution in the environment. We also have the cervix and the uterine cancers in ladies. We understand that is because of their makeup. Also, we have the stomach cancers and other cancers. But it's good to note that the breast cancer is high in ladies compared to the other cancers, and colorectal worldwide comes second. Next slide, please. When we come to men, that is males of all ages, we find that for men, there's a tie between lung cancer and prostate cancer. Prostate cancer, we understand that is from the men having the prostate gland, and with age, there are some changes which happen. But for the lung cancer, that can be due to lifestyle, maybe pollution also. So it also has a high percentage. Colorectal also appears, which can also be attributed to maybe some lifestyle. But these factors will later be explained by another presenter. Also, we have liver, our esophagus, and bladder cancers. Next slide. Yeah, these are the references that we used to obtain that data that has been presented on the previous slides. Thank you very much. And in case of any questions, this portion we are presenting with Veronica Kihugi, and she's also on board. So in case of any question, you can direct to either me, Felix, or Veronica. Thank you very much for your time.
Thank you. Thank you, Felix. We will now move to the next presentation, which is by George, who is the head of cancer awareness here at Cancer Research Kenya. George, welcome. Are you able to project your slides?
I'm George Onyango, and I'll be taking you through risk factors and symptoms of colorectal cancer. Thank you, David. So when you talk of risk factors, these are the components, chemicals or matters that are within an individual's control or out of their control that increase the chances of getting or developing colorectal cancer. So there are risk factors out of one's control. That is, either you are born with the some malfunction or some genetic mutation, or you have history of colorectal cancer in your family. For example, maybe your grandmother, grandfather, or someone in your bloodline had colorectal cancer. By genetic factors, we mean there's a gene that you inherit that increases your chances of getting colorectal cancer. Suppose these happen, or suppose you are experiencing, or suppose you are inheriting these, they increase your chances of developing what we call colon polyps, as my colleague had said. And these are risks. Another risk is old age and type 2 diabetes. So by old age, we say as you grow old, your chances of developing these, cell masts within your colon increase. We're not saying that younger people cannot, develop them, but we're trying to say that comparing a younger person to an adult or a senior adult, a senior adult has some higher risk as compared to a younger person. Yes. Next slide, David. Yes, thank you. Then there are also risk factors within one's control. So these factors within one's control are mostly lifestyle issues, like diet, the food you eat. Yes. Maybe you do junk. Yes. Maybe you're a vegetarian. Maybe you love red meat. Another person doesn't like this type of food. So this is what we call diet, and diet determines or increases your risks of exposure. Secondly, inactivity. Yes, you are poorly dieting, then you are inactive, and these two combined, they increase your body weight or BMI, and BMI increase your what we call the lipids accumulating within your colon. So these factors also increase the risk of polyps developing, and polyps, or those cell mass within the colon, are the primary contributors to developing colorectal cancer. Smoking is also there, yeah, and alcohol use. Yes, smoking, you're exposed to a lot of chemicals, and the smoke maybe it corrodes the lining, or the cellular lining of your colon. Same to alcohol. They increase the chances of the cells growing at an extraordinary rate. This happens to increase your chances of developing colorectal cancer. Next slide, David. Thank you. So, when we talk of symptoms, we mean the signs. What can tell you that there are possibilities that you have colorectal cancer? So, the symptoms depend on, okay, they may be minor or non-existent at early stages. Yeah. So you find that you've developed polyps, but nothing shows you that you have polyps in your colon or your rectum in that case. So in this, research says that most people expressing symptoms of colorectal cancer experience it at the second stage and beyond. So you can imagine if you're going to be diagnosed at stage 2 or stage 3 cancer or stage 4, like in the case of Ken Okoth, who Felix mentioned, issues with late diagnosis or misdiagnosis. So I think these are a significant challenge for people experiencing or have colorectal cancers, but they don't know. You realize it at the third or the fourth stage or the second stage. Yes, that's a big challenge. Yes, next. Yes, we have early warning signs. What can tell you that? Okay, in as much as colorectal cancer can be detected at later stages, but there are some signals that can tell you that I think I'm not okay, or I think this is off. And the moment you detect them, you can go to the clinic or where your primary care provider is, and you can get tested for this type of cancer. So we say early stage colon cancer does not cause symptoms, like I said, but these are the signs. But suppose you experience, maybe you can go for a checkup. The first one is sudden weight loss. We have narrow ribbon-like stools. And by sudden weight loss, I'm not saying this is, it's not like restricted to this type of cancer condition or disease. You can have sudden weight loss, but it's not a sign of a colorectal cancer. So we have narrow ribbon-like stools. You experience this stool when your colon is constricted, and for that case, you find that you excrete a stool that is ribbon-like, yeah, which is not a normal occurrence. Then we have bright, dark red rectal bleeding. So as you pass out stool, you are, it scratches the polyps or the growth within your colon. Then it results in the bleeding. So you find that your stool is ribbon-like and it has black or dark red rectal bleeding. Another early sign is tenesmus, and by tenesmus we mean you feel like emptying your bowel, but you go to the washroom, nothing. You feel like I feel like emptying myself, nothing comes out. That is the tenesmus, and that's an early sign of colorectal cancer. We have anemia, iron deficiency, then persistent abdominal pain. There's this pain that you just feel your lower abdomen. You also feel some pain that is not normal, and it is consistent. You experience that, we advise that you go for a checkup because it is good for your health. Better detect at stage 1 and get help than ignore such signs, and it's devastating. Next. Yes, we have local symptoms. What are local symptoms? Local symptoms only affect the colon, and we experience them when colorectal cancer is at the primary stage. The polyps are just forming. So it means that still the cells that are affected are still within the colon. It has not spread yet. So at that stage, one would experience constipation, diarrhea, alternating diarrhea and constipation, rectal bleeding that would be mentioned, or bloody stool, abdominal bloating, cramps, discomfort when you are, relieving yourself. Then you feel like you want to empty your bowel, as I said earlier. Then, of course, again, thinner than normal stools. Yes, next. Then we have systemic symptoms. So systemic symptoms, now the cancer is spreading. It's moving from the colon. It starts affecting maybe the lymph nodes of your abdomen. So when that happens, you experience the following: unexplained loss of appetite and weight. Then you have nausea, vomiting, jaundice, anemia, general body weakness. Then there's fatigue. Yeah. So, and you can see the signs are very related. Like what? Like the unexplained weight loss, and the blood in the stool, and red ribbon like, ribbon like stool, and what? And weakness or fatigue. So this, it's so abnormal for one to experience this combination of symptoms when you are right, or we are not. When the condition is, is not cancer related. So you go through an combination of these, like I say, and like we always advocate for, always go for checkup. Don't assume. So this is systemic symptoms elaborated further, and as you can see, patients do not notice symptoms before diagnosis. Most patients, and that's a challenge. You see people with the pancreatic cancer, they also experience the same challenge. They always, it always shows up. The symptoms become aggressive when it's advanced stage. Yeah, like in the case of Kirubi, I think he had pancreatic. So you realize that a late stage and it's difficult to deal with. So symptoms depend on the tumor size also, and where cancer has spread outside the colon or rectum. So, like when it spreads to the bones, one would experience, undergo through pain, fracture, constipation, high calcium levels. And this can like in high calcium levels, you can only know when you get tested. Then we have in the lungs. So colorectal cancer that has spread into the lungs. People experience short breath or difficulty breathing, coughing, pain, and fatigue. You feel you cough consistently, and you feel pain while coughing. Yeah, that is colorectal cancer that has spread to the lungs. Then in the liver, we have nausea, feet and hand swelling, jaundice, and fatigue. Your skin is just yellowish. You don't have the, yeah, it just turns yellow, jaundice, unexplained. Then you're tired. So like you see, fatigue is again coming here, and fatigue is like in the bones, you will feel pain and fatigue. Lungs, the same. So like the symptoms are consistent as cancer spreads from the rectum or colon to other parts of the body. In the lymph nodes, for instance, you will always experience bloating, swollen belly, and appetite loss. In the brain, cancer to the brain or spinal cord, memory loss, headache, blurry vision, seizures, difficulty speaking, confusion, and pain. Yes. Next. Yeah. So I think those were the signs and symptoms. I mean, yeah, risk factors and symptoms of colorectal cancer. Yeah, and these issues are not just our own words or our own, statements. We've researched them, and they're documented by credible organizations. Yeah, cancer foundations. Yeah, the CDC, and these are just they're not just organizations. These are bodies dealing in thorough research, and that's why you are saying you experience such signs, it's better you go for a checkup. It's never too late. You never know. You go, maybe it's at stage 1, it's at the primary stage, and you'll be one of those heroes that you celebrate around for beating this dream. Thank you.
Patrick will take us through our diagnosis. So, karibu sana Patrick.
Okay, thank you so much, David. And let me share my slides kindly.
Okay.
Okay, thank you so much, guys. And welcome to ICRF. My name is Kuria Patrick, an oncologist. And we were doing this presentation with Faustin Mutua, who is also an oncologist. I'm going to present on diagnosis. So let's go to the next slide, David. Well, in diagnosis is a very vital part when it comes to not only cancer, but to even other medical diseases. And one should be very keen on making a diagnosis of a certain disease, both the patient and the doctor. So it's good whenever you want to make a diagnosis to always start with the medical history and the physical exam. This is where the healthcare provider is able to ask you some questions, do some examinations on your body. And some of the questions may include the family history. We've been told the family history is one of the risk factors when it comes to colorectal cancer and other cancers. So if there's any case of or history of cancer in your family, any kind of cancer, it's always important you as the client to point it out to the doctor. Then it's also good to mention all the symptoms you're experiencing. In matters concerning the colorectal cancer, you've been told about the symptoms, the bloody stool, the abdominal pain, the tenesmus. So it's always good to bring them out honestly. Then it's also good to talk about the previous treatment and radiation. We know some of these cancer treatments are also risky in case the client or the patient, for that matter, has had a previous history of the treatment, this cancer treatments or radiation. It's good to point them out. Then also about bloody stool. When it comes to physical exam, this is where the doctor looks for masses through palpation of the abdomen. He also looks for enlarged organs, maybe the liver, the spleen, or any other enlarged organ. And also there's an examination called the DRE, the digital rectal exam. This will help tell more about the rectum part of it. Then the next form of diagnosis is the blood test. This is the basic form of diagnosis. And you know about the CBC, or the complete blood count. This helps to monitor the disease process. When you talk about cancer, cancer is someone is diagnosed with cancer or rather cancer is abnormal multiplication of cells in human body. Actually multiply the kind of which are the function of other normal cells. So you may find experiencing the symptoms of, for example, the red cells, the oral produced by specific. For example, a very basic example is the cancer. We all know about the PSA, or rather the tumor marker. The PSA is specific to prostate cancer. When it comes to colorectal cancer, it also has its own tumor marker, which is called the carcinoembryonic antigen. So blood tests, one is able to determine which tumor marker, so that the doctor is able to. Then we have another form of diagnosis, which is the colonoscopy. Colonoscopy is an imaging kind of diagnosis where a tube with a camera is inserted through the anus and goes around the colon, from the rectum to the colon, all around the colon, and by this the doctor is able to appreciate the image of the whole colon from the rectum, noting any abnormalities that this particular tumors in the colon. Then we have the proctoscopy, only visualizes up to the rectum. With microscopy, also just like the colonoscopy, that is able to reach. So it's good to note that these three imaging, the colonoscopy, proctoscopy, and sigmoidoscopy, they are done when the patient is sedated. So that causes it's a bit uncomfortable when doing the procedure. The next slide, kindly. So yeah, we were at biopsy. So we talked, I briefly explained what happens during the biopsy. It surgically removes a small part of the tumor. It's examined under a microscope by a pathologist. And through that examination, that's when a definite diagnosis of cancer is made. So for example, there's a tumor in the colon, maybe after colonoscopy after colonoscopy or rather, biopsy is done, examined, and this is able to tell us whether the cancer is benign, is it malignant, and this is a confirmative diagnosis of cancer. The other form of diagnosis, we have the computer tomography scan, or the commonly known as the CT scan. Well, this from different angles, and these angles help to produce a 3D and clear image of human organs. So let's say you have an abdominal CT scan. The abdominal organs are able to be visualized this CT scan, and in a clear image tumor, and it's also able to tell if the cancer has spread. We have another form of imaging that is the ultrasound. So this ultrasound cannot accurately tell or detect cancer that has spread on to near lymph nodes or beyond the pelvis. So the ultrasound will just show you some tumor, but don't tell whether it is spread or how big it is. Then you have the X-ray. X-ray is mostly commonly used to detect metastasis, or if the cancer has to other organs and more so to the lungs. In the human body, there are those organs in the body that are very prone to bone marrow. Those are areas where the cancers or most cancers spread to. So through the X-ray, for example, on the chest, it helps detect if there are signs of spread. The other slide, David. Then another form of imaging is the MRI, or the magnetic resonance imaging. This is just like the CS, but the MRI uses magnetic field to produce the clear 3D images. We have another one called the PET scan, or the positron emission tomography scan. This one is not very common in Kenya because of factors like it's very expensive to get one. So in the PET scan, it uses some radio tracers which are injected to your bloodstream, and these radio tracers are made in such that they collect where there is a tumor in your body. So once they collect around the tumor, they are able to send the emissions to the PET, to the scan, and the scan is able to produce image of that specific tumor. Then we have the other one, that is this is not an imaging, this is a lab test called the molecular testing of the tumor. In these kind of tests, what happens is the pathologist extracts DNA from this tumor, and through the studies and examination the pathologist does, is able to determine how this abnormal multiplication of the cells are dividing. It's able also to tell at what point of cell division. We all know about the cell division process, the interphase, telophase, all that. So through that study of the DNA, the pathologist is able to know at this point of cell division is where the most cell division is occurring, and by that the pathologist can also help tell the kind of treatment to give for that cancer. So the kind of treatment is given to target the point of cell division. I hope I'm clear on that. The next slide, kindly, David. So those were the forms of diagnosis. Then we have the screening. The difference between screening and diagnosis is that screening, you are trying to look for cancer in people without cancer. So we are all advised to always do early screening so that we can detect these cancers early. And we have two forms of screening. We have the stool-based test, and we have the visual or the structure exam screening. In the stool-based test, we have the fecal immunochemical test, or the FIT test. In the FIT test, it basically tries to look for hidden blood in stool. So this test detects only human blood that is present in the stool. As we remember, we talked about the risk factor or the symptoms. Sorry, bloody stool is one of the symptoms of colorectal cancer. So that's what happens in the FIT. We also have the stool for DNA tests. And the stool for DNA tests, this is a laboratory kind of test that detects abnormal DNA changes associated with the colon cancer that is present in the stool. Then the other form of screening is the visual structure. This one looks inside the colon and the rectum for any abnormal areas with cancer or polyps, and we have talked about them. They are the same kind of sorry form of imaging we talked in diagnosis. We have the colonoscopy, we have the CT scan, and we have the sigmoidoscopy. So these visual exams are able to appreciate any tumors present in the human body. The next slide can be. So there are some guidelines that are given for screening for the colorectal cancer, and also the guidelines are divided into two. We have the average risk people. The average risk people are the people that are not known or are not suspected to have colon cancer. So those are the people that have not been exposed to most of the risk factors we talked about. So in the average, or the high risk people, sorry, are the people who have a history, or rather are exposed to the risk factors of colon cancer. May it be family history, may it be radiation, may it be previous cancer, all that. So in the average risk people, the guidelines said that screening should start, or people should start screening of colorectal cancer from the age of 45 up to 75. And then above 85 years, most of the times it's not recommended. But we also have an age bracket that is missed there between 76 and 85 years. This one screening is, it's always good before you do the screening to consult the doctor. So if you're between that age bracket of 76 to 85, consult with the doctor depending on how your symptoms are, and the doctor will guide you on what specific kind of screening you have. So for the fecal immunochemical test, for the average risk of people, it's good to do it yearly. For the DNA test, that is a stool for DNA tests, it's good to do it every 3 years. For the colonoscopy, it's always good to do once after every 10 years. For the CT scan, it's good to do it after every 5 years. And for the sigmoidoscopy, it's also very important to do it after every 5 years. So it's good to note that those are the average risk people. Then we have the high risk people, or those that are being exposed to the risk factors of colorectal cancer. So those people with a family history, screening should always start before 45 years, and preferably around 30, from 30 years. So if you have a family history, not specifically to colorectal cancer, maybe any other cancer, it's good to start your screening from the age of 30. Those people who had a history of polyps, always do your screening every 3 years. May it be imaging, may it be the lab tests, the colonoscopy. Then for those who have a history of colorectal cancer and undergone surgery, it's important to do the screening after every year. This I'll explain this a bit. This is because of most cancers tend to recur. So it's important if you had a history of a certain cancer, just go and do the screening so as you detect any form of cancer or that specific cancer if there is any chances of recurring. Then you have the history of radiation. You should at least do 5 years, every 5 years of screening, and preferably before that years. If you had a history of inflammatory bowel disease, inflammatory bowel disease is the inflammation of the digestive tract. It's good to do screening every 8 years. And after, let's say you had it this year, after 8 years of after treatment and it's cured, do a screening after 8 years. Okay, the next slide. So these are some of the diagrams so you can appreciate what a colonoscopy is something like that, inserted through the anus, to the rectum, to the colon, inazunguka the whole colon. That is a colonoscopy. The next one, Kelly. This is still a colonoscopy, and that's how the head of the colonoscopy looks like. We have a small torch and a camera, so that it's able to take the images of the colon. I have the next one. This is a sigmoidoscopy, similar to colonoscopy, but just reaches at the sigmoid part of the colon. You were shown the anatomy when we are starting the presentation. Okay, the next one. This is a proctoscopy. This one reaches only the rectum. And the next one. Well, and I think I'm done. And thank you so much for your attendance and listening to my presentation. That was all about the diagnosis. Thank you.
Thank you, Patrick. So right now we will now move on to prevention, and I'd welcome Jairus to continue from here. So welcome, Jairus.
Thank you, David. I'm Jairus, a member of Cancer Research Kenya, and I'll be taking you through prevention. On prevention, Next slide, please. On prevention, the most important and powerful tool to know if you have colorectal cancer is regular screening. This will help to identify the cancer before the signs and the symptoms develop. It is recommended if you are at the age of 45 or older, then you should start getting screened for colorectal cancer. There are several types of tests that can be used, as Patrick has elaborated on diagnosis. And these, some of them can find and remove cancerous growths in the colon or the rectum. Therefore, the earlier you do the cancer screening, the better the outcome. It is good when you suspect any abnormality, you talk to the healthcare provider about which type of screening is good for you. No matter which test you choose, the most important thing is to get tested. Next slide, please. Another way of preventing colorectal cancer is through diet and supplements. For the diet, there are many studies that are linking the reduced intake of processed and red meat to lower risk of colorectal cancer. So therefore, it is recommended that as a person, you reduce on taking in more processed meat, red meat, which will help to reduce the risk of colorectal cancer, and work on having a plant-based diet like grains, legumes, and fruits. Fish and poultry can also help to replace the processed meat. Some studies are also indicating that calcium and vitamin D supplements can reduce the risk of colorectal cancer. Although these are studies that are still underway, and more information will be out in future. Next. Researchers are looking at the role of some medicines in preventing colorectal cancer. And such medicines are like aspirin and non-steroidal anti-inflammatory drugs. It is suggested that when you take aspirin at low quantities or small quantities, they might reduce the development of precancerous growths in people which have the history of colorectal cancer. Although there are serious or life-threatening side effects for these drugs, such as bleeding from the stomach, or someone might have stomach ulcers. So before using such drugs, it is recommended that you seek doctors' interventions, you seek doctors' advice on the best way to go. Next, please. There are some lifestyle habits that us as people we have been practicing, and from the presentation, the picture, you will see some of these habits. such as smoking, taking of alcohol, and people who don't maintain their weight. Just to start, we have increased physical activity. When someone, or if you don't do more practice, more exercises, you might be obese, and obesity is one of the risk factors that can lead to colorectal cancer. Another one is limiting alcohol consumption. It is good to know that although it is hard to avoid these habits, but it is good to change. So if someone, or if you are taking alcohol at large quantities and you can't quit, it is recommended that you reduce the intake of alcohol, either at 2 drinks per day or 1 drink per day. Then we have knowing your risks. Knowing your risks and getting screened on time, which I have discussed on the first slide, and reducing or eliminating red and processed meat. Nowadays, people prefer meat more than vegetables, but for your health, for the goodness of your health, it is good to balance between the two. Next, please. Therefore, having explained that, these are some of the references we use to get the information we have shared about prevention of colorectal cancer. Thank you.
Thank you, George. And Yema is here.
Okay, hello, good evening. My
Evening.
name is Andiema. Yes, my name is Andiema Teriaron, and I'm going to take you through nutrition during the treatment, during and after treatment of the colorectal cancer. So I hope Rani David will help me with the slides, because I'm not able to project it for you. So maybe you can move to the next slide. So nutrition is a very important factor when it comes to colorectal cancer. This is because nutrition, and it's almost a core for healthy living for any person, and especially it's important when you are in the treatment of colorectal cancer. So for one to be healthy, you have to observe that you observe what you eat. You make sure that what you eat is healthy, and what you eat is healthy, and you make sure that during the treatment, especially for the people who have been diagnosed with cancer, they make sure that they follow a diet that is good and supports their recovery and health. You can move to the next slide, David. Nutrition guidelines during the treatment of colorectal cancer is important, and it includes the maintaining of a healthy weight. One can maintain a healthy weight by reducing. You can avoid weight loss by getting enough calories. For people who are maybe their weight is below standard, they can avoid weight loss by ensuring that they get enough calories every day. And for those people that are obese, they can maintain their health weight by losing weight. And it is preferably not advisable to cut weight during the treatment of colorectal cancer. So you have to talk with your doctor to see if you can be allowed to lose your weight. But it is important that you don't lose your weight during the treatment. So you'll have to wait until after treatment so that maybe you can lose, but maintaining a good health weight is important. Essential nutrients too is important. Getting essential nutrients such as the vitamins, carbohydrates, minerals, and water is important too, because it helps in maintaining and regulating the body so that your body will work at optimum and have a proper immune system defense for in case of in case of the infections. Also, you are supposed to be physically active to make sure that your body is at a good state to fight diseases and to help you recover from the disease. You can move to the next slide, please. There are several ways you can get the essential nutrients, and also make sure that you maintain a good weight. And this is through maybe seeking nutrition counseling from experts, and the experts include the registered nutritionists and dietitians. You can talk to a nutrition, and mostly if you talk to a nutrition expert, they will tell you that there's some foods that you're supposed to avoid, and these foods include refined starches such as packaged cookies and crackers. Also, you are supposed to avoid adding sugars or added sugars in foods, and mostly these are common in sodas and other sweet drinks. Saturated fats, foods that have saturated fats also, you're supposed to avoid them, and these include the meats like hot dogs, processed meats like hot dogs, whole milk and cheese, fried and also fried foods. Also, you're supposed to avoid foods like trans fats, including margarine and coffee creamers. You are advised you to take you take more foods that are important, which will contribute, which have the anti-inflammatory the cancer. So the foods that are good for you to take are vegetables and fruits, especially vitamin K rich leafy greens such as the spinach, kale, broccoli, and cabbage. Also, you have to eat fresh fruits, plenty of fresh fruits that are rich in color like cherries, and also other fruits. You should take more plant-based proteins such as beans to replace the proteins from animal foods such as the red meat maybe, and also all other proteins from animals. Also, you should take a whole and refined grains, including the oatmeal, brown rice, and some other cereals, which also they are still whole. Or you can also take fish high in omega-3 fatty acids such as salmon and tuna. Or also, you should take foods that are high in fiber. Herbs. We should also take herbs and spices that are high in antioxidants such as turmeric and garlic, which will also help you in recovering from the condition. So if maybe you don't know where to get the information, you just need to go and seek help from nutrition, or even just go to the doctor, and they'll give you the specific nutrition needs that you need to recover from the cancer. The recommendation mainly that they give you include the vitamins and nutrients that you are not receiving enough of, and also they will tell you to take liquid nutrition supplements to help you reach your goal. That is, maybe if you want to ensure that maybe you get your body, you get enough energy that will help you fight on and maybe remain strong as you are treated. They will tell you the supplements that you need, and they will also help you in seeing to it that your diet is according to your recovery plan. Please move to the next slide, please, David. yeah, nini taking nini nutrition, the side effects that comes when you are being treated from the cancer, and this includes cancer treatments that have side effects such as the diarrhea, nausea, mouth sores, taste changes. These side effects may affect it makes it difficult for one to either eat or drink. So I came up with a tips that will help you get the nutrition you need in case you experience these side effects. Number one, when you eat small meals, you should eat small meals per day. That means that if maybe you are taking 3 meals in a day, you should now be taking maybe, let's say, 6 meals, or you eat intermittent foods during the day. You take maybe, for example, 6 meals in a day. This will ensure that you get all the maximum nutrients that you need, and also you get you eat like it increases your appetite too. So foods, in case you experience the bland taste, maybe when you eat something you feel like maybe you're not feeling the food, you feel it's tasteless, or you should add some flavorful spices that maybe will increase your appetite and also make you want to eat more. You should also take in case you should ensure that you take plenty of fluids too, such as water. And if maybe water, you're not able to take water, you should take foods such as watermelon, which have high water content in it, so that maybe you remain hydrated and you don't get dehydrated. You should also take vegetable smoothies. That is in case if you have this mouth, you have maybe gum infection or mouth sores that maybe will prevent you from eating other foods that are maybe solid. So you just use a blender or any other food processor that will maybe mix the foods and make it to be like in the form of smoothies that you can take easily, that will not affect you or affect the way you consume your foods. Please move to the next slide. The dietary supplements are also important when it comes to the treatment of people that are suffering from people that are suffering from the cancer, the colorectal cancer. So people that are suffering from colorectal cancer should be given low dose dietary supplements, which include the vitamins, and these are helpful for people, as in they will help them get their nutrients through food. Multivitamins are dietary products that contain most of the required daily vitamins and minerals and other trace elements. The dietary supplements contains calcium, magnesium, or iron. These are typically, they always taken by way of as a pill or a tablet or liquid or any other form, and even in the powder form. It is recommended that people are given the supplements in lower doses, because high doses of the supplements can be harmful. And it's also known that maybe it can affect the treatment that maybe you'll have been given by your doctor when you are being treated from the colorectal cancer. So it is advisable that you seek help from your healthcare practitioner, maybe who is taking care of you, or maybe who is helping you get through who is helping you recover from the cancer. Next slide, please. So there is these are the questions maybe that you'll ask your doctor in case in case you are taking the supplements, and you can ask them what the questions include. What are the benefits of taking these dietary supplements? So you can ask them. They will tell you the benefits. What are the possible side effects? You should also make sure that you ask them. You should also ask if there are any risks that are associated with taking the dietary supplements. Also, you can taking the dietary supplements interfere with your cancer treatment. so that maybe you are more advised. So when you are taking these supplements, you don't put yourself also at risk, and you make sure that you have the balanced nutrients that your body will need for recovering and for also the normal functioning. You should also ask how much you're supposed to take, and for how long you're supposed to take the supplement. And also you can ask where you can learn more about the supplements. Next slide, please. Food safety is important also when it comes to nutrition and colorectal cancer. This is because of the infections that maybe one can be at risk. One can be susceptible to. So you need to observe hygiene and make sure that the foods that you eat, as long as you are fighting to recover from the disease, from the cancer, you make sure that you eat what is hygienic. And I've put for you here the ways in which you make sure that the foods you eat are hygienic and that they are safe for consumption. And you need to wash your hands before and while you handle the foods. While you are preparing your foods, before you take them, you make sure that you follow the right procedures so that you don't take bacteria and other viruses that maybe could have contaminated that food. So rinse vegetables also and fruits thoroughly before eating them, which that is also important. Storage of foods is also important. You should make sure that you read the precautions that most of the foods that we buy maybe from the supermarkets, they have the precautions. So you have to make sure that you read them carefully and you make sure that you store your food safely. Also, you should eat foods that are well cooked. They are fully cooked. So this will enable that you don't eat foods that maybe they have, for example, if you eat raw meat, that one might have some serious health implications on you. So you make sure that you eat foods to kill germs and other things that are in it. So, and also to make the nutrients that are in it maybe more accessible to your body. Do not eat or drink unpasteurized foods. I talked about this proper storage of foods, and also you should check the expiry dates so that you avoid eating foods that have expired, which might have some serious health implications on you. And make sure that you check your health. You also don't get to get again sick from another infections. Next slide, please. Then we go to the diet and nutrition after the treatment. You should eat foods that are high. You should eat a diet high in fruits, vegetables, and whole grains. I think I said this, but I'm going to repeat it. Eating nutrient dense and plant-based diets foods. Also, from what the previous speakers had said, you should quit smoking. Smoking mainly it contributes also to the carcinogenic elements that may cause cancer and may also lead you to getting the colorectal cancer. Maintain a healthy weight, minimize the consumption of alcohol, and you should remain physically active. And maybe during your treatment, I know most people, when you're sick, maybe you cannot get that physically active, so you can just engage in yourself maybe in some few exercises at home. Maybe you can even engage yourself in some walks, and you just walk around maybe your house so that you remain active. Move to the next slide, please, David. Oh, I think I've reached the end of my slides. There we have, but these are the references as where I got the information. These information are not my own in me. They're not my own knowledge, but a research that I've done in the internet, and to make sure that I can at least give you some information about the nutrition and colorectal cancer. I think that is all for today. Thank you for listening. Back to you, David and George.
Thank you for the presentation, Aaron. We will now move to Gideon, who will present the last part of our awareness today. So, Gideon, karibu sana. You can now
Yes.
proceed.
Okay. Thank you so much, David. Okay, so I'm going to give a talk on treatment and survivorship of colorectal cancer, and based on what we have learned so far, so we know that is a disease that affects the colon, and the colon and parts of your organs of the digestive system. So next slide. So the treatment goal that, or the way in which we approach treatment of the colorectal, it first of all, it depends on the stage of cancer, such that you can find that due to lack of awareness, or especially what we are doing at the moment, due to the failure of awareness, most of our patients that we have in Kenya, they are diagnosed at a very advanced stage of colorectal cancer. So the goal of treatment, we basically approach treatment based on at what stage have we been able to capture or have we been able to make a diagnosis of colorectal. So if you make a diagnosis at an early stage, which is most preferred, then it is easier to manage. But if you make a diagnosis at a later stage, it becomes very hard to manage. So for early disease, what we are planning to do when we are treating is first and foremost to remove any cancer cell, because at an early stage, the disease has not spread. As we know, cancer is a disease which spreads. So if the disease has not spread, it becomes very easy at early stage just to remove the area that is diseased. Another way in which we can manage early disease is by killing the cancer. This is the use of radiotherapy. So radiotherapy is only effective, not majority of the time, is only effective when the cancer is localized. By localized, I mean the cancer has not moved. The other thing that we do is by keeping the cell from returning. So our objective at early stage, you can either cut by surgical, you can burn by something called radiation, and your aim is to ensure that these cancer cells, they don't recur. Then in an advanced stage, whereby the cancer has already spread, it is not confined in the intestine, it has moved maybe to the nearby organs or the nearby lymph nodes. So the objective here, you want to slow the progression. You don't want the cancer to continue spreading at a faster rate. If you are not able to do that, then your objective will now be able, if you make a diagnosis of an advanced colorectal cancer that has already spread maybe to other vital organs, such as the lungs, the liver, and you cannot do anything to that patient, we purpose to just improve the quality of life. And that is what we are calling palliation. So you're treating, but you know at the back of your mind that you are not going to do much. So you just want to ensure that the patient is able to live the remaining days of his or her life and enjoy them. So next slide. So in early stage, we do local treatment. So if you make early diagnosis, then you do local treatment. And this is what I've already mentioned, that you can cut, you can radiate, or you can do something called ablation. Ablation is either by exposing that cancerous growth to either heat, too much of heat, or too cold, something that is very cold. So you expose it to something like nitrogen, which at that is very cold, at more than -80 degrees Celsius. So your objective is just to kill the cells. And this is what you're calling local treatment. Next slide, please. So how do we do this surgery? So the surgery is a mainstream mainstay treatment for colorectal. So we do this by either something called laparoscopy. Laparoscopy is whereby you insert something like a tube that has a camera, and it also has some knife kind of that you pass through the either through the skin or through the mouth as a tube, and then you go and resect, or you cut the area where you have the growth. You can also, if you're not using the laparoscopy, which is a modern way of doing surgery, you can do something called colectomy, where you cut a large portion of the colon. So you cut the area where you think the cancer is, and then you resect. You tie the remaining part together. And then after that, you can either decide to give radiation or use chemotherapy, depending on the extent of spread of the cancer. So if you think, despite the fact that you have cut and you think that maybe the cancer has spread, you do something called an adjuvant. So you give chemotherapy afterwards. Next slide. So ablation and embolation. So it's basically, I've already explained, where you can use high radiofrequency ablation or cryoablation. So here you remove small tumors that have not spread, or you destroy them. Embolization is used to treat tumors, especially those which have spread to the liver and they have blocked either the vessels of the liver. So the cancer cell, at times, they can actually pass into the vessels, and they can cause blockage of arteries in the digestive system. Remember, after you have eaten, food will move to the colon, and once you absorb food will move from the colon to the liver. So majority of these patients, they get obstruction of vessels in the liver, and that is what we do by embolization. So you are trying to remove the cancerous which are in the vessels found in the liver by dissolving them. The next slide, please. Then we have radiation therapy. So we said you can cut. That was what we had discussed. The next thing, you can radiate, and radiation is using of high energy rays. So these rays are concentrated on cancerous cells. So if you have cancerous cells, they are dividing faster. So if you expose them to high energy rays, the high energy rays will cause damage to these cells, and these cells will die. So you can either do radiation alone, or you can combine radiation and chemotherapy. Chemotherapy are the anti-cancer drugs. So if you combine radiation and chemotherapy, we call it chemoradiation. So radiation is effective most of the time when you have localized or cancer that has not spread. I think you've already mentioned this. Next slide. Then, if the cancer has spread, most often from stage 2, 3, and 4 of colorectal, I think we're going to look at the stages. You cannot, even if you cut the area that has cancer, it is not going to be effective. So the best approach would be that apart from cutting, you need also to give some drugs. And there are 3 ways in which we use to treat colorectal cancer. You can improve your immunity to fight the cancer cell, what we call immunotherapy. You can use chemical agents that are very toxic to kill the cancer cells that are dividing very fast, what we call chemotherapy. Or you can use the newest form of treatment, we call target therapy, whereby the drug is focused only to have an effect on the dividing cells of the colon that are abnormal. So it will spare the normal. That is what we call target therapy. Next slide. So chemotherapy is one of the traditional, though it's still used even in modern time, traditional way of treating cancer. So cancer, we know they're just cells that are dividing faster. So if you use a drug that is poisonous on any cells that are dividing cancer, that is what we call chemotherapy. And there are two forms. We can have systemic, whereby you inject drug through a vein, and then it goes and it affects anywhere you're having rapid cell division. So we know that your hairs are growing fast. So in your hair, you're having rapid cell division. And that is why when you use chemotherapy, people tend to lose hair. So that is called systemic chemotherapy. We can also have regional chemotherapy, and in regional is where you inject drugs to that specific area that has tumor. So you're injecting the chemicals that are toxic to a growing tumor. Next slide. So the other approach in terms of treatment of colorectal cancer is immunotherapy. So one of the ways in which cancer is able to thrive in our bodies, because cancer normally causes your immune to go low. Okay, so cancer causes someone to lose their immunity. Nowadays, we are using a form of treatment called immunotherapy. And immunotherapy is basically you're boosting your immunity to fight cancer. That is what we are calling it, immunotherapy. Next slide. And finally, we have target therapy. As I said, in the chemotherapy, we said you give systemic. So you're just giving drugs that they kill anything dividing faster. So by the chemotherapy, you know, anything dividing faster, you will have a lot of side effects. I have given an example of losing hair because your hairs are dividing faster. So nowadays we are moving from chemotherapy to target therapy, and in target therapy, you're focusing your drug to kill only the areas that you want to treat. So you will kill only cancers of colorectal, and you spare the hairs or anywhere you have cells that are dividing but they are not harmful. That is what we call target therapy. Next slide. So treatment is based on, one of the key things that we look at is the staging. So we have stage 0, stage 1, stage 2, stage 3, and stage 4. So stage 0, it means the cancer has not spread. It is just on the surface of the lining of the colon. Stage 2, it has moved a bit deeper. Stage 3, it has now, stage 1, it has moved a bit deeper. Stage 2, it has moved to the nearby lymphatic nodes, the structure you are seeing green in color. Stage 3, it has moved beyond the lymphatic to the nearby organ, and stage 4 is now, it has metastasized or moved to other areas of your body. Next slide. So stage 1, we have already said. So in stage 0, the cancer is still in the lining of the colon. So here you just need to come and cut. So if you cut or you do something resection, then you know you have high chances of curing, because you have been able to make a diagnosis at an early stage, and you can just remove an area where the cancer is about to thrive. Next slide. Stage 1, the cancer has moved from the lining. It is now involving several layers of the colon, as we saw in the other slide, but it has not spread to the near lymph nodes. So here you can still do surgery because the cancer is still confined on the lining of the colon. So if you do surgery, you are sure that you have removed the cancer cells. So once you do surgery, there is no need for giving treatment. Next slide, please. Stage 2, the cancer cells have now moved. They are not just found on the lining of the colons, they have moved into nearby tissue, but are not yet in the lymph nodes. So apart from doing surgery, you also need to give other treatment because the cancers are not confined on the colon, so they have moved to nearby tissue. So you need to cut. At the same time, you need to treat. You give the chemotherapy to clear the remaining cells that are in the nearby tissue. And that is what you're seeing. We are giving the 5-FU and leucovorin and the last bullet. Next slide. Stage 3 is the same as stage 2. However, in stage 3, you have involved the lymph nodes. And here you, apart from doing colectomy, which is cutting of the colon, you also give chemotherapy to treat the cancer cells that have already spread. Next slide. And finally, stage 4, this is now the cancer has moved to not only to the areas or nearby tissue of the colon, it has moved to other tissues in your body. So the cancer can either metastasize or move to the liver, to the lungs. And here your target is not only to, you don't target, here you're not targeting to treat. Here you're just targeting to prolong life and to ensure that the patient lives a comfortable life and they'll die comfortably because there's not much you can do about it. The cancer has already spread to the liver, to the lungs, to the bones, and so forth. So here you do a combination of surgery and chemotherapy and radiotherapy just to prolong life and to ensure that their quality of life is good. Next slide.
And
Yeah, so thank you so much.